Okay. Well, thank you everyone for joining. Today I was going to give you a demo of the ISTEP that we have right now. It's on test, and so you can get a view of what's out there on test. There are some updates that I want our programmers to make before I release it to you. But I just wanted to at least give you a glimpse of so you can see what's coming. I didn't know, Erin, was there anything that you would like to cover today or start out with? Or
I don't have anything in particular other than just a reminder that the continuation applications are due today, and I know most people are aware, or not today, excuse me, due Friday. I know most people are working on those, and just wanted to give you a heads up that if you haven't gotten them, you still got time, but due Friday.
Okay. Well, we'll go ahead and jump in. You should be able to see my computer screen, and this is in test, so I don't have real people information up here. But I wanted to, today I want to cover the ISTEP. So one of the things that you just go to your group, your customer group, and I have some information entered for Natasha CYP, so I'll go to Natasha's account. And we have added, you'll see that we have added an ISTEP tab. So ISTEP stands for Individualized Service Training and Employment Plan. And we have this as when you first come to the ISTEP, we give you an overview, okay? And the overview gives you, it just bubbles up the information that's been entered into the ISTEP. And when you're starting an ISTEP, we have these numbered up here. So we want to try to always give you like a guidance, a process, and we'll be adding an area up here for instructions as well. But you'll see it's 1, 2, 3. So the first thing as part of the ISTEP is you're going to complete assessments. So we say complete assessments, enter the initial summary information, review the results, and add, do additional summaries if needed. So when you first come here, there's not going to be anything down here. But we want you to look at, we have it as view results. Maybe we need to change that to assessment results just to make it more clear that you know that this is the area where you know where the assessments are. So you can click on view results, and this should look very familiar to you. There are some things that are already in the assessment tab, the overall assessment tab. We can update this assessment tab, and I guess I'd like your feedback from the end user. You can start, when we release it, start using it and let me know. The idea, with this assessment tab at the very top, it's our standard across the board global assessment view. But then after reviewing the ISTEP and looking at these assessment results, I'm leaning towards putting all of these in this assessment tab because I don't want to confuse you to say, oh, well, I'm looking at assessments, but like, where are they? Where's all the other information? So, you can give me your feedback on what you think. That's what the area I'm leaning towards. So, just for consistency, so you know where to find the information. Skills, again, this is test, so you're going to see skills and interests. If I had this person, you'd be able to see their interest results. The employment goals, this is information that's taken from their application. You'll be able to edit this information from this page. That's where my programmer needs to add the button to edit this. So you'll be able to edit this information as well as enter a wage goal. and the areas that they may be interested in going into. So whether it's like the health science industry, or maybe it's arts and entertainment, and then also you can just continue to be updated. So you can include specific occupations. So maybe they wanted to start out as a CNA, and then they wanted to go to maybe a LPN, or whatever the case may be. You'll be able to update that information in their employment goals. And this isn't just like a one-time and done. I mean, for this program, for what you're working with, it very may well be. But the idea is that this can be updated. After you're working with your customers and they learn a little bit more. Maybe once they started this work experience, they're like, no way, I don't want to go into the health industry. Maybe not. But the idea is that you can update their employment goals because they may change over time based on the experiences that they have. The education level, this is the information that would come from their application as well, their employment-related information. So if this particular person had any employment history, you would be able to see their employment history. The barriers, you can identify the different barriers that are associated with this person. And that would pull in from the barriers that have already been identified, but you can update those. If they had a disability benefits estimator results, you'll be able to see that. The same with Employment 101, observational evaluation, worksite evaluation, but again, it's all tests, so they're not in there right now. If you have some additional assessments that you do at your location, my programmer needs to add a button here, but it's just like the other assessment tab where you can enter more assessments. Maybe it's the TABE test, maybe it's whatever is part of your process for assessing your customers. So once you have those assessments that you do, you're going to add an assessment summary, and this is just a narrative. Maybe like later on, Aaron or other DHS people may have different best practices or the different information that they would really like to see in each of these categories. Right now, we're really leaving that open for you. You guys are the experts on assessing your customers, and so it's just really a summary of where they are at that point in time. So once you add that assessment history, you can see that I already added one, and it'll say that the assessment summary was added by this partner on this date, and this is the information that was in there. We do allow you to edit this assessment information, but again, we wouldn't expect you to go back over time and edit it. You would just add additional assessment summaries as needed. So whenever you take a look at their assessment, where they are at this point in time, then the next thing is to set goals. So maybe you're working with a person that some of their barriers are they need transportation, or they need child care, or they are homeless. You can go ahead and enter the goals. So, if you have a person, especially the one that has significant barriers, what you really need to do is, address their immediate needs. So what we have here is you select a goal state, or you select the button to add a goal statement, and you would say, just really short, I think we left it to like 144 characters, like a tweet. And so, maybe the goal statement is to to meet the customer's child care and transportation needs. You could put that in there. And then you could say that it was a supportive service. And you could say, well, this is a short-term goal because we need to take care of it like right away. And you can identify and say if it's not started on track, off track, or if you're already taking care of it. So maybe it's like, they need child care. You can say that, okay, we got that taken care of. That immediate goal has been met. So I have some examples here. So we have get support services lined up to help ensure workplace success, gain permanent employment with the employer in the health science industry, get trained, certified as a caregiver. So, I know for the goals of this program, is that we want to put them into permanent employment, and that we want to provide support services to help to make sure that they're successful in their support in their work site placement. But then, know that you can still use this tool to help them think about, you're starting out as, a person that, I don't know, maybe it's doing cleaning or doing maintenance or doing something in a facility, but they can, learn what it's like to be a CNA or a nurse or something like that. And so, if they show an interest in something like that, you can add in longer-term goals that may include some kind of education and training plan. And Erin, feel free to jump in here at any moment if you want to add comments to this.
I was going to say, I think it looks great, by the way. You guys have done great work. It looks real nice.
So again, once they're listed, you can edit them. And so we just want to know if they're on track, not started, or complete. The next part, so now we have our statement, our goal statement. So now what are we going to do? We're going to start building our plan in order to reach those goals. So we're going to click on Build a Plan. Now, this system this is a global LMI WorkNet tool. Okay, so when I say it's a global LMI WorkNet tool, you're going to use it for this program, but it's going to continue to be enhanced and added more features and available to our other partners as well in the future. But right now, you guys are the lucky ones. You get to start out with this version. And so what we are going to do, the system is going to generate services. So for starters, we're going to put in services that are related to CYEP, okay? And so you're going to select from the list of system-generated recommended services, so in this case, CYEP, and then you're going to identify the services. So if you open this up, you'll see oh, well, these are all the services that are related to CYEP. There are going to be additional tags, metadata associated with it, so that in the future we can really narrow down and take our larger collection of services and really hone those in towards specific projects and so forth. But this is where we are for starters. So that's why you'll see, excuse me, this tag for CYEP. That's what that means. As we move forward, we want to add tags to our assessments. So if a person, based on whatever the results are with their assessments, we can recommend services. That's why we have these tags here. Within this area of recommended services, so you say, okay, if I have, right now you only see 8, so let's say we have 20 of them here for CYP. Well, that's great, but I kind of just want to see what's available for self-services. You can filter by self-service, staff-assisted, and we don't really have anything for referrals yet, but we're starting out with self-service and staff-assisted, but we'll be building in the referral piece. Then we have the filter by category. So okay, well, this is great. Again, I just want something that we're starting out with goal 1, is to meet their immediate needs, and I'm going to click on support services. What's available for support services? Well, what you see on my screen right now is I just have a service entered for transportation assistance. So I can add that service, and it'll show up in my plan services. So these are the services that are available. Once you click Add, it'll go down to your next section, which is your plan services. So you're going to edit the plan services to identify goals that are related, because, again, these are just a bunch of services. You need to connect them with the goals And those are the steps that would need to be complete in order to reach that goal. So you're going to associate them with goals and barriers that the step addresses or takes care of. The status, service provider, dollar value, and we'll be adding more items to that as well, such as credentials and so forth. So you look at the plan services. So I added a few plan services already. And I have some information added for these. This note icon, this note column right here will end up being like a little icon to save space. We're going to add some other icons here so you can see which ones of these were address a barrier, which ones have a cost associated with them, which one has a credential associated with them. So those are some enhancements that we're going to continue to build out. For starters, you'll be able to, when we release this to you, you'll be able to easily identify which services are related to barriers and have a cost or a barrier associated with them. So I went in, and for example, for transportation assistance, I'm going to click this little pencil icon. This is the edit button. And we're going to put the name of the service up here, which will say, transportation assistance. I'm going to have it aligned to one of my goals. So the set of goals will be different for each person. It's pulling from that list of goals that you had customized for that individual. So you can select which goal it goes to. You can identify the start date or planned start date and the planned end date. You can put in weekly hours. In this case, maybe put 0. You can put the information in there as far as notes, whether you're going to issue a bus pass. You can say if it's started or not. You can put the completion date if it's complete. This is a field we need for another program, so for you guys, the WIOA funded is just going to be no. And then you can address the barriers that are associated that this particular service is going to take care of. So the 2 items that were identified for this particular person was they have limited transportation and the cost of transportation. So I went ahead and I checked both of these. So if you have a service here and you're like, well, wait a minute, I think that covers some more barriers that haven't been specifically checked off, or if you just want to see, you can do the show more barriers, and it's going to show a long laundry list of barriers that you could choose from. And then you can update that service. We also have a service provider section so that it'll default to the grantee and their name and all their contact information. But if there's some other service provider, you can click Other, and you can type in that information. And then this will be, like, as you continue to add in providers, you could just it'll use autofill. So if you start to put in the word test site, it'll pop down and you can just select it and it'll go ahead and populate these other fields. So we want to minimize if you have any additional information that you've already entered into the system. We don't want you to have to re-enter it 15 times. Either it's going to populate with your information or what it's been saving for other provider information. If you have any dollar value or that's been associated with this particular service, then you just simply, we're keeping it really simple right now. I'm sure that over time we'll be adding more features to this, but at least at this point in time, you can say, I added this, another bus pass for $15, and then it'll just continue to build into this. And then I want to have my programmers add like a total cost so it can keep a total, a running total for this. If you need to edit it, you can edit it, or you can simply delete it. Okay. So that's these are the tabs like for a specific service. Again, you can add case notes anywhere in these areas, and it'll populate the case notes field. Now you saw the kind of like the guts of like building the plan. Now I want to go back and take a look at the overview of the plan. So what we're going to have is, as you enter in this assessment information, if they had a CIS, field and interest inventory, which that's what you guys are doing already, it'll have that it's been complete. You'll be able to see that their pre-assessment or post-assessment, that those have been complete. You can see if they're not these complete. Go here. You can see more about their assessment. This information is pulled from that employment goals area that I talked about, that we're going to add the edit button. So you could say that this person said that they wanted to go into the health science industry. Maybe they wanted to do CNA, LPN, and whatever their wage goal is. This will just be a field that you can type in. It's a text field. And then this will give you a summary of the information. So you can see how many goals were completed and how many services were completed. You'll also be able to see a short list, I guess, if you want to call it that, of what the goals are. So these are the 3 goals that have been identified for this person. My programmers need to add a little link here that you can click on, and it'll expand out to show the services that have been associated with that particular goal. So what will be nice about this is you'll be able to see a summary view of everything with all the goals, as a subset, and a summary of the services that are aligned with each of these goals on the same page in this view. You can see which category that they're associated with. Excuse me. You'll be able to see excuse me, the plan start date, and this will be generated from the earliest start date of your service that was entered and aligned to that goal, and then your plan end date. So this will be the date that's associated, the due date that's associated, the latest due date that's associated with those services that have been aligned to that goal. And then an update that I'm asking my programmers to make is that these are a link, so that whenever you're looking at this page, you can be like, oh, wait a minute, I already did this. This one's complete. So you can just click on it and update that goal to complete. So, the other part of this is that we want to have just confirmation that we had, in some cases, like, for a plan, a career plan, some people call it a individual employment plan. There's a variety of names for it. But many times you have to sign off. The customer has to sign off that they agree to the plan. And so what we have is an area where the customer would agree to the plan. So they could either do this through logging into their side of Illinois WorkNet and agreeing to it that way, or you can print the customer copy and then upload that. They can sign it, and then you can upload it to the account so that it shows that the customer agreed to the plan. And then if any of the goals have been updated, if any of the goals have been updated, then it would just say, just send a message to the customer to show that they agree that the goals, they're in agreement with the updates to the plan. So I have a little bit more work to do before I release it out to you, but I would fully expect to have this released to you by next Wednesday, if not earlier. Any questions?
I do see Emma asked the question, do we need to go back and enter this information for clients that are currently working? Ideally, every client would have this information on file. You know, to the extent possible, I would say do your best to get this information in there for the clients that you've got.
Right, and one of the things too, in your plan services, they need, again, my programs need to update this particular one that I have it in here is get permanent employment. And what it will do is use the fields that are in worksite placement. So you can, once you have your employers and everything already entered up front, you can go ahead and enter them directly into, like, create the service and update worksite placement at the same time. How do we access client success stories after they complete them? That would be on my workNet. This is my we have a little widget here that shows success stories, but then we also have a success story area over here where they could find, where you can find local success stories. Another question coming in. Okay. You know what? I'm wondering if, let me check to see if they have been approved. Let me see the people that, let me talk to Olivia, and if they're not displaying here, then they may not have been approved. Because whenever you submit a success story, then we review them and approve them. But I'll check with Olivia on that. Okay.
I am glad to hear that people were completing those success stories. That's great, and we're glad to have those, so thank you.
Okay, do we have any other questions? Be related to what covered today or other areas that you might need assistance with? All
right. Seeing none, we'll go ahead and dispense for the afternoon. But just again, a reminder: applications due, continuation application, and I look forward to having those and hopefully being able to get everybody set up that chooses to continue, getting them set up for FY19 starting in July. So thank you again for all your work, and Natasha, it looks great. Thank you for your work, and look forward to the next information we get. All right.
All right. Thanks so much.
All right. Have a good afternoon. Goodbye.
You too.